One advantage of being last is if you have difficult questions, I'll just run. So I work at Hamilton Health Sciences. Actually, my job was cut in the last budget stuff, so I work now in orthopedics, but I'm still involved in the cancer world outside of Hamilton Health Sciences. And we have actually a course for people who work with women with breast cancer, which maybe we'll advertise through you. So I'm involved with these various associations, and really my goal is by the end of the talk that you'll understand some of the evidence behind exercise, specifically for people with multiple myeloma, but a lot of this applies to other people with cancer as well. One of the challenges, and I guess I'll say this now, if you ask me specific questions, I won't answer them, because I can't give safe exercise without assessing you, and everybody's different, and you heard that several times. General questions I can answer, but I can't give specific exercise recommendation to a person without assessing them. So physical activity and exercise are two different things. So what we're doing today, we're actually mostly not being physically active, except for those who went out to walk a little bit, but physical activity is what we do every day. Get up, go to the washroom, go for a little walk, take the dog for a walk, which is great, but that's not exercise. So when I talk about exercise, the idea is that you go out with the goal of improving fitness, and everybody's different. For some people, exercise will go for a 15-minute walk, and for some people, exercise will be going to the washroom, because that's hard for them. So everybody has independent exercise, but I'm talking about exercise, not physical activity. Both are important throughout any stage. And why do I care about that? When we do research or when we teach people, again, we want to have a clear message. And my message is that you really, to have the benefits of exercise, you need to exercise. If you do physical activity, it's great. Walking the dog is great, but if the dog stops every 10 meters to do their business, you're not really getting the benefits of exercise, you're doing physical activity. So that's really what I'm trying to emphasize. Recurrence for a person with any type of cancer, and especially with multiple myeloma, it's a concern and it's a worry. Is this a good pain or is this a bad pain? And it's a really hard pain, I guess. It's a pain to diagnose the correct pain, if that makes any sense. But really, and we heard that also in the other talks as well, we can't help if we don't know what you're going through. And we can't educate you what's a good pain, because some pains are okay versus a bad pain. So I'll try to clarify that a little bit as we go along. So in general, there's evidence growing that people who exercise are less likely to get some types of cancer. We heard from the previous talk, there's almost now 30-odd something different types of multiple myeloma. There's over 200 different types of cancer, and each one of them has their own subgroups. So there is no one cure for all of it, at least as we know right now. So exercise has been shown, for example, for women with breast cancer, those who exercise are less likely to get breast cancer. Unfortunately, there's no guarantee in anything. People can do everything right and things don't go well, or people can do everything wrong and live forever. But so there is a component of luck or bad luck to some degree in that as well. Definitely people who exercise get diagnosed earlier. They tend to be more in tune with their body and they notice something's wrong. So exercise helps with that as well. There's good evidence those who exercise can tolerate treatment better. And I'll talk a bit more about evidence shortly, but if somebody can tolerate the prescribed treatment, maybe the outcome is better as well. And actually it's not a maybe, it is true for some cancers as well. Sometimes during treatment, the goal is not to get stronger, it may be to slow decline, because the treatments are pretty strong treatments. But once treatment is done, that's when you get the bang for the buck with exercise, and there's lots of evidence for that as well. So when treatment is done, people recover faster when they exercise. Some types of cancer, those who exercise live longer than those who don't exercise. It's true for women with breast cancer, prostate cancer, some lung cancer, a little bit of research there, some colon cancer. It's not known yet for some other cancers like multiple myeloma at this point. Not knowing, it means we don't have the research to support it. It doesn't mean it has benefits. It was also mentioned that at least in the past, multiple myeloma was a diagnosis of people who are a little less younger than others, who have other problems. Exercise is good. We all know exercise is good for people who have heart problems. It can make people live longer. So it can handle some of the comorbidities associated with being a little less younger. And of course, those who exercise tend to have less recurrence than those who don't. So specifically for multiple myeloma, there's very few prospective studies, and prospective study means we recruit you now and then the study happens, versus asking you what you remember about what you exercised in the past. And the difference is when we ask people what they remember about their exercise, we're pretty biased about how much we exercised, and our memory seems to be a little altered. We tend to think we exercised way more than what we did. And the results are mixed. So in preparing for this talk, there's a couple studies that showed really no correlation between exercise and preventing multiple myeloma. And you know, is it environment? Farmers who generally speaking are very strong, active people, you can say they exercise regularly. There was no correlation, but there was one study that found that those who walked less than 30 minutes a day were more likely to get multiple myeloma than those who walked more than 30 minutes a day. So there is some evidence, but it's definitely not something that I can clearly say we can prevent multiple myeloma with exercise. So is exercise even possible? Many people are diagnosed when they have bone pain, often with injury to the bone. And some of the people were saying, well, you need to stay in bed, you need to protect your bones, it's dangerous. So definitely exercise is possible. With the diagnosis of multiple myeloma, it needs to be safe. And beyond the disease, there's the quality of life, which was mentioned earlier. For some people, quality of life is more important. For other people, quantity of life is more important. There is no right or wrong answer. Everybody's different. But exercise has not been shown to cause injury as long as it's done safely, which is really the key message. People had improved mood, improved sleep, and reduced fatigue. And I'll talk more about fatigue afterwards as well. Some of the barriers to exercise, so I can talk about exercise forever, which is fine. However, nobody will do it unless they get over some barriers. And we had the talk earlier about the supportive care and pain. Really, if somebody's in pain, they won't get up and exercise unless they really probably need mental health assessment. But even though those who exercise tend to take less pain medications, usually pain needs to be controlled first before somebody gets up and exercise. And I'll talk a bit more about pain and fatigue a little later as well. People don't go exercise in gyms because of fear of infections, and that's an important fear as well. Low self-motivation. You know, it's much easier to not exercise versus to exercise. And people think, well, I've never exercised in my life, it's too late for me now. There's actually good evidence to show that it's never too late to start. Doesn't mean you need to go run a marathon, and hopefully you don't, because then you'll probably come back with some broken bones. But everybody's different, needs to be safe, but everybody can start, and it's never too late. For the men, men tend to exercise less than the women, and that's considered a barrier. Not much we can do about that for most people. But you know, getting somebody to help you get motivated is really important as well. For people who had the stem cell transplant, they tend to complain more about fatigue being the barrier to exercise. People who didn't have stem cell transplant, pain tends to be the barrier to exercise. So for each person, again, we need to work independently to figure out what works for that person. Lack of knowledge of safe exercise, and it is a challenge. As a physiotherapist, I think we are one of the professions who can help educate you, but many physiotherapists are not comfortable working with people with multiple myeloma because it's very complicated. There is no cookie cutter approach. And if we don't know, as physios who specialize in this world, it's really much harder for the physician. And for a physician who doesn't know, it's much easier to say, don't exercise, versus trying to learn more about safe exercise as well. Not that physicians say that, although some do say that, but really, we need to help you learn more on how to do things safely. If somebody has, for example, a lytic lesion in one shoulder, they can still exercise the two legs and the other arm. If there's a will, there's most of the time a way to do things. And then there's other health conditions, whatever it is, unrelated to the cancer. So some of the facilitators are things that help people to exercise. So making a promise either to yourself, to family, to others, usually helps somebody to stay motivated longer. Encouragement from family and healthcare professionals. One thing about family, a comment, there is actually a little bit of research to show that you should not exercise with a spouse because they tend to end up in a fight versus encouragement. Something to think about, but some people it does work, but there is a little bit of research to show friends and support groups may be the better partners for exercise. For some people, I'm sure it works okay. If somebody's getting chemo, right after chemo may not be the right time, or the 2 weeks after, or whatever your regimen is, when the counts are lower, that may not be the time to exercise. I'm not a believer in never exercise. I'm a believer in modify the exercise. So if somebody, for example, did 10 minutes on a bicycle during a good day, during chemo, 1 minute is fine. Just let the bloods recover and then adjust the exercise program for that. Those who believe that exercise would help tend to do more exercise, of course, versus those who believe it will hurt them won't do. It does make sense, but it is something, and that's why I'm here to hopefully most of you will be believers by the time you're done the talk today. Somebody who exercised before is more likely to exercise after. Of course, they have the experience, they get the high from the adrenaline and the lactic acid, and they love that pain. So they tend to exercise more than other people as well. There is some evidence that if the blood is supplemented with the various supplements, those who exercise tend to do better with the exercise, and routine and setting goals, and I'll talk about goals in a moment as well. So some of rest, it was mentioned in the earlier talk about rest. Rest is important sometimes. And again, I never say zero exercise, I say modify the exercise. So right after chemo, it may not be the right time. If somebody has an active bleed, then it's definitely not the time to exercise. Need to wait until it happens. Extreme pain, and we'll talk about pain again, and the nurse practitioner, I guess we think similarly because we have the same slides, even though I never met her before. Extreme pain is not the time to exercise. Or low hemoglobin. If somebody has low hemoglobin, they can exercise forever, but they'll never really improve their fitness while it's low. They may slow decline, which is sometimes a goal as well. The problem with rest, it reduces our aerobic ability, so we can do less. The more we rest, actually, the less we can do over time. One of the biggest activities that happens that for somebody after diagnosis is waiting. You go to the cancer, you wait for the blood work, you wait for the results, you wait for the chemo, you get the chemo while you're waiting, and then everything is a wait at the cancer center, and that's a great place to get weaker. We can't do the same activities that we've done before, and by we, it's not only the patient, it's also the family, because most people go with family and wait with them, and it affects everybody in the family as well. And fatigue. Fatigue is a big thing as well, and sometimes it's needed. There's actually only one evidence-based treatment for cancer-related fatigue. And being a physiotherapist, you probably know what it is. It's exercise. There is no pain that helps fatigue. You need to have the blood work corrected first, but that for itself does not correct fatigue. Exercise is really the only thing that corrects it. Some more of the research that was done on people with multiple myeloma. Those who exercised had the same level of red blood cells after exercise, but they needed less transfusion to maintain their levels. So that's important for some people as well. Those who got ready for stem cell transplant, those who exercised got better stem cell collections, which is important as well. Again, an important thing is no adverse events, i.e. nobody hurt themselves because of the exercises as well. And exercise could be walking, that's okay. If you heard the joke, you can pretend you laugh anyway. But if you take a dog and they stop every lamppost, it's not exercise, right? I mentioned that. But if you pull them and they need to hold it for 20 minutes and they can pee only once you're tired, then it's exercise. And the tired can be different, depends where you are in a cycle of treatment. One day it could be 5 minutes, one day it could be 10 minutes. You just need to listen to your body, and we'll talk about that a little bit as well. A little bit more research for people who had stem cell transplant. Most people started their exercises before the stem cell transplant and continued it until after discharge from hospital. My goal is it continues really for life. One of the annoying things about exercise is once you stop it, it's not beneficial anymore. It's something that needs to be continued forever. And there are significant benefits for those who exercise, those who didn't. So these charts, really all we care about is the diamond at the bottom. If the diamond is on the line, that means the study really didn't do anything. If the diamond is on the far side of the line to whatever that side is, physios never know they're right and left. That means it was significant and it was beneficial. If it's on this side, on my side, then it wasn't helpful at all. So for all of these, for cardio, lower extremity strength and upper extremity strength, there were significant benefits for people who exercised before transplant, during the hospital stay until they were discharged. And it was safe. So what can exercise do for most people? Most people were healthy, but also for people with cancer and multiple myeloma, different exercises do different things. So for example, aerobic exercise helped with immune suppression. For some people, pediatrics who had hematological cancers, there was a immune suppression right after exercise, but then it went back to normal level or higher level. And that was aerobic exercise. Aerobic exercise is cycling, walking, where the heart rate goes up, similar stuff like that. For the heart improve, both strength and aerobic exercise. So strength is weights. I'm not a big keener on the stretchy bands because the farther you stretch it, the harder the resistance, and it can hurt you if you don't know exactly what you have. For aerobic exercise, for the lungs, aerobic exercise, again, was more beneficial than strength exercise. For the GI, aerobic exercise was beneficial. For the muscles and the bones, you need both strength and aerobic exercise. And it was mentioned earlier, weight-bearing exercise for bone health. That's true unless you have really bad arthritis in your joints, whereas weight-bearing is not the right exercise for you. So this is where we need to balance and assess each patient individually and know how to monitor and adjust for them. For the nerve and the endocrine system, aerobic and resistance exercise, both of them were important in different ways. And for some of them, we don't know. The research is still out there, and we still have lots to learn. Generally speaking, those who exercise have less nausea, they have less emotional distress, shorter duration of the low blood counts, so blood counts recover faster, less fatigue, improve. Some of these make sense, but before you actually present it, you need to do the research on it, so people can have higher endurance, they can walk more, improve sleep. Sleep is a challenge for many different reasons. It could be the chemotherapy, it's stress, it affects everybody in the family as well, and the drugs themselves, of course. Quality of life improves and strength improves. So how do we keep the exercise safely? And really, if you go out and exercise right after this talk, and you hurt yourself, you probably won't exercise as well. So really, safety is really important. It's also safety for you and whoever's with you, because if you fall and your caregiver needs to lift you up and they hurt themselves, they can't help you. They can't be the caregivers anymore. And that's something to think about as well. Need to think about where you're exercising. If it looks anything like my basement where you want to exercise, it's extremely unsafe. If you get ejected from the treadmill, who knows what you fall on. So really, the environment is important as well. Everybody, unfortunately, it was mentioned, everybody here will have different precautions and contraindications, things that you're allowed to do, not allowed to do, and what you need to be careful for. Everybody has different side effects. Some people will have neuropathy on the same medication treatment, and other people won't have neuropathies. So everybody is different. And there'll be different levels of side effects as well. So really communicating with us and telling us what's going on, then we can work one-on-one with each person to figure out their own specific precautions. So when not to exercise. So if somebody wakes up in the morning and they really have problems going to the washroom and they have shorter breath and it's new, then they should not exercise and it should be investigated. If that's their normal, then that's okay to exercise. So this is where things get a little more complicated. Excuse me, we mentioned bone pain, and as you know, all know, bone is a big part of the body that is affected by multiple myeloma. If there's a new sharp bone pain or new bone pain, it needs to be investigated before you can do exercise. If somebody shoveled the snow and then you have a bone pain, it should be investigated. If it just feels like a tight muscle, maybe give it a little bit of time before you get it investigated. This is where we need to listen to our body. So I mentioned the one treatment for fatigue is exercise, but if somebody gets up, you go from the bed to the washroom and you just wiped for the rest of the day, then maybe exercise is not the right time for that. It may need to be a rehab program where they can build you up slowly. So extreme fatigue is not. Fatigue is yes, extreme fatigue is not. Dizziness, of course, everybody's probably extreme fatigue by Sunday afternoon at 2:30 p.m. It is a busy weekend. Dizziness is definitely, if it's a new dizziness, then it's not the time to exercise. If that's the normal, then safe exercise can be possible at that time. So low blood counts, I mentioned already about the red cells. If the hemoglobin is low, it's harder to exercise. People will get shorter breath sooner. Most of you know your blood work better than the healthcare team, but some people don't want to know, which is okay. But it's hard for us to prescribe safe exercise if we don't know what's going on. So if somebody's hemoglobin is low, may get short of breath sooner than their usual. They may get heart palpitation or dizziness when getting up from sitting. Everybody usually gets dizzy in the first few seconds, first 10, 15 seconds after sitting or laying down for a while, but then it should clear up. If it doesn't clear up, or if it takes a few minutes for that dizziness to clear up, maybe the hemoglobin is low. If somebody bruises or bleeds more than the normal, I live in Hamilton. Nosebleeds is a normal thing in Hamilton, but for most people, it stops within a short amount of time. If it takes a longer time for that to stop, then normal, maybe the platelets are low. If the platelets are low, exercise may not be safe at that time, or it needs to be modified as well. Most people won't know when their white cells are low unless they do blood work. But really, infection was mentioned earlier, and it's something need to be careful about. If you find that you're getting sicker than the usual, and you don't know your white cell count, then it should be time to check it out as well. Exercise needs to be modified if it's in the bones. It doesn't mean you can't exercise if the cancer is in the bone. It doesn't mean you can't exercise. It just means it needs to be modified, and it needs to be done safely. So for example, if somebody has a involvement of the thigh bone, the muscles around the thigh bone start beyond the knee and start at the pelvis. So we need to know that and modify our exercises to keep the bone safe. Everybody's different. If somebody has numbness or peripheral neuropathy in the hands or feet, so in the feet, treadmill won't be a good thing, because then tripping is a bigger thing, and ejection out the back is a bigger activity. But maybe an elliptical, if that's what you want to do, could be an option, because the feet don't come off the machine, so it's a little more stable. If there's numbness in the hand and feet, doing dumbbells over the head may not be the smartest thing to do, and especially if you drop things, holding things. So this is where, doesn't mean you can't do it on the side of the body, so if it falls, it goes on the floor. So this is where thinking and modifying the exercise is important. Back pain, I don't know here anybody, and if you've never had back pain before cancer diagnosis or caregiver, you're pretty lucky, but everybody has back pain at some point in their life. It doesn't mean it's cancer, right? Most back pain goes away. Jan is a nurse practitioner who I work with, and we do a lot of teaching together. Her 2-week non-scientific rule is if the pain is there for 2 weeks and it doesn't go away, get it checked out. If it goes away within a few days, then you probably don't need to check it out. For most people who hurt their back from non-cancer related activity, it's usually in the low back. It may radiate down to the leg and then go away. Stenosis is also normal with becoming less younger over the years, and it is just part of wear and tear of the body. It doesn't mean it's cancer-related pain. But if you do have that diagnosis and you're worried about that the pain may be related to the cancer, really don't exercise until you get medical attention. That's what we're there for. That's how we pay our mortgages. Don't feel bad about checking out with the healthcare team. Check out with the doctors. I know this is recorded, but that's how they pay for the bigger houses versus the physios. But that's what we're there for. We're there to help and keep you safe as well. If somebody has back pain and no other symptoms, it's not an emergency. And I'll explain what other symptoms are in a second. But you should get it checked out as soon as possible. And the next bullet is really what the nurse spoke about earlier. If there's new back pain and there's change in sensation in the legs, change in normal bowel and bladder function, but the legs feel weaker or heavier than before, really that isn't a medical emergency, and you should go to an emergency room ASAP and say, I think I have a spinal cord compression. And usually that will bypass the wait list. Not always, but it should, because that is time sensitive. So if somebody has new back pain, change in bowel bladder, change in sensation, or strength in the legs, straight to emerge. Not that I want to scare you, but it can help keep you walking much longer. So pain control is not easy. And it's really hard, as my little person at the bottom, it's really hard to get comfortable when you're in pain. And many people are worried about being addicted to pain medication. There's actually people who have real pain, and it was mentioned in the other talk as well, don't get addicted most of the time. That's because the body uses these chemicals differently, and it takes care of the pain. And it's, I'm a physio, I love exercise, but really I haven't succeeded getting people's pain 100% away without the medications. So really we need to work together with the whole team, need the right medication. Everybody needs a different combination of medications. But really I'd be unemployed if the pain medications weren't available. If you can't sleep at night because of pain, you most likely won't exercise in the morning. Everything is connected. Quality of life is affected with bad sleep and being uncomfortable. TENS, which is electrical stimulation, can help with pain. Acupuncture, we heard about that, can help with pain. Acupressure for some people helps as well. Radiation for certain areas is helpful as well. We need the pain under control before really we can work on getting you stronger. Depends on what you read. Anywhere between 40% to 100% of the people who participate in studies report fatigue. And I mentioned muscle wasting. That's often related to the weighting. And some of the medications. Steroids is part of the treatment. The steroids given for multiple myeloma are not the bodybuilding steroids. Unfortunately, it's steroids that weaken muscles. And I'll give you one exercise that everybody should do if they can when they leave here. Malnutrition is part of the fatigue as well. Chemo changes the taste buds. Things don't taste good anymore. It's hard to stay healthy as well. I talked about sleep already, pain, depression, all of that, they're all linked together. Ways to reduce fatigue. So it's a daily routine. It was mentioned earlier with the bowel. It's not different at all. Exercise needs to be part of the routine. Pain medication and balancing activity and rest. It's really hard to get really active during treatment. As I mentioned, it may be slowing decline or staying the same. But afterwards, once treatment or between treatments, that's when you can recover the most. So doing exercise effectively. How much time do we have? Are we okay there?
We started a few minutes late, so we've got another 20 minutes.
Oh, okay, no problem. So where to start? If somebody never exercised, and if you go out to exercise now, you'll probably hurt yourself and curse me forever, and that's it. You won't invite me to come and talk here again, ever. So that's not the time. So people who never exercise get some advice from physiotherapists, there's kinesiologists, there's fitness trainers who are trained to work with people with cancer. I'm biased. I go with physiotherapists. I admit that. But get help from somebody who knows. And if they say they know, ask them where they learned it, because some people said they learned it and online or something, but really you want to make sure they actually know what they're talking about. Don't start too hard. One of the things we do with people with cancer, we don't start an aggressive exercise program. We start low and build up. That reduces the risk of injury. Walking is an exercise. Just modify how long before you take the rest. And for most people, it's a safe exercise as well. And then just know when you need to modify it. Everybody's different. Those who are experienced exercisers, again, you need to modify it. One of the people I had in the past was a weightlifter. Well, unfortunately, that's not something they could do anymore. Once you have the bone involvement, it's really hard to go back to jobs like that. So need to modify it. There's a way to modify it. Again, you need to start slowly and progress. So if somebody's been on treatment for multiple myeloma, you can't go back to where you ended before. The muscles are different, the bones are different, there's other medications in the body. Doesn't mean you may not get to the same level, you just need to start low and progress, and the progression may be quicker than somebody who's a new person to exercising as well. There is evidence that if exercise is progressed too soon or too hard, fatigue is worse. So even though exercise can help fatigue, it needs to be correct exercise to help fatigue. And I don't know how many here in the room, but if you don't do something you like to do, how many of you will get up and willingly do that every day? So you need to find something that works. Everybody's different. For some people, their exercise may be dancing. For other people, it will be walking. For other people, it will be something else. Need to find something that you enjoy. So staying motivated, it's always hard. And everybody's guilty at some point, even those of us who exercise a lot over our lives. At some point, we become a little lazier, and it's much easier to grab the ice cream from the freezer versus go out for a run. So if exercise was easy, everybody would be on that pill. But we don't have that exercise pill yet. So we actually need to do it. It doesn't help. I can talk about it forever, but if we don't do it, it's not helpful really. And another, I mentioned that already. So if somebody exercises great and does great for many years, and then we stop within, and these are some studies that were done with football players. They were put in bed for 2 weeks, and they actually, within 2 weeks, they lost muscle mass. So, and for people who are getting treatments, chemotherapy, steroids, or whatever, the weakness happens faster than that. So that's the hard part about exercise as well. So how to stay motivated? Walking around the weight room while waiting for the doctors, parking far away. One of Dr. Mike, I think, in one of his drawings and education online, he calls it the spots reserved to those who want to live longer. The spots far away from the door. Walk to get your coffee versus the drive-through if you can and have time. If somebody likes the gym and their immune system is fine, going before work, exercising while watching TV. Oh, right, there's water here. I mentioned the exercising with others. For those who does work with spouses, that's fine. Grandchildren, if they're not snotty, as we heard earlier. Find the right partner. Everybody has a different partner, but usually that works better as well. And balance the hassle. Exercise is a hassle. If you work hard, you stink afterwards, you need a shower. So it's a hassle. But there are benefits to it as well. So we need to balance both worlds to find what works for you as well. Setting goals works. I mentioned that earlier. If it's number of steps on a pedometer, those little gizmos that fit on the belt, and you can really pretend to exercise while you're shaking them, drinking your coffee. Whatever works for you. Set a goal and then work towards that goal. Give rewards to stay motivated. If I walk a certain amount, I'll get a book or download a game or whatever you enjoy doing as well. Find what limits you from exercise. Is it boring? Is it rainy? Is there a mall somewhere I can go exercise? Whatever it is, think, okay, why don't I want to exercise, and figure out a way to work on that barrier. Canada, bad weather, man. Anyway, so find ways to get over the bad weather. That's often a barrier. People say, I exercise every summer. Well, we only have summer for 2 months out of the year, seems like. So really, we need to exercise regularly. Use an umbrella. Or it's a new invention, apparently. Whatever it is, figure out what you can do, make it work for you. Lack of time. Everybody's busy for many different reasons. I mentioned the parking far away. Walk for 5 minutes, get up earlier in the morning, whatever works for you. So this is just an example of a SMART goal. It needs to be specific. So I'm going to improve to 30 minutes on my exercise bike or on my pedometer. So you measure it in this time, it's minutes. You can do it. So if I say I'm going to go for a 10K run, most likely I'll have a heart attack halfway. So it's not realistic for me. And then a reward, and then I'll try to achieve it before I'm 88 or something like that. So it needs to be realistic, otherwise it's not considered a SMART goal. So this is just an example that anybody can use, and well, I like the blizzards, by the way. That's usually a good goal to get exercise going. This is to see if anybody's awake enough to read my slides. Try to do exercise daily if you can. Warm-up is good. There's actually no good science for a warm-up that I've seen, especially for people with cancer, but everybody says warm-up is good, so warm-up is good. Generally speaking, it gets the heart going, it gets the head into the exercise. Theoretically, you can become more flexible. Warm-up, easier to stretch afterwards. Doesn't matter what the exercise is, walking, climbing stairs, as long as you're allowed to do that, and you can do that safely without falling down. Riding a bike, a stationary bike. I often have people put a chair behind their stationary bike, so then they don't fall going onto the stationary bike. So it's almost a homemade recumbent bike. So sitting in a chair and pedaling. Now you can get pedalers at various drugstores as well. So whatever works for you. If there's no back involvement, sitting on a bouncy ball, one of those big balls, while watching TV, and just sitting and bouncing lightly, nothing aggressive, that already uses the core and uses the quads a little bit. No high impact exercise. Generally speaking, that's not good for our bones. It's good when we're young, and it's good for getting arthritis, which keeps me in business, so that's okay for the young people. But really, that's not a good thing for people with bone problems. So no high impact exercise. No pain, no gain is wrong. For many people, pain is a sign that something's not right. It's okay to have some muscle discomfort after the exercise. If you never exercise, you'll have some muscle discomfort 2 days later. That's okay. But really, going for pain is not the good thing to do. Any exercise. Aerobic, anything that gets your heart up, and I'll talk about that in a second. Stretching, as long as it doesn't cause any bone pain. As you can see, it's really, this is good, but. So this is where everybody is unique, and cool down. If somebody can't lift a certain amount of weight because there's a bone lesion somewhere, they can increase the number of repetitions. Just lift 10 pounds, or not 5 pounds many times. Just do more repetition versus higher weight. You can still get strength with that. Endurance, start flat and then increase speed or comfort to wherever. Everybody's different. But there's always a way to progress, and there's always a way to make you work. If you're not tired, you probably didn't do enough. And tired will be different for each person as well. There's a RPE, rate of perceived exertion. This is where it's individualized. 10 is however hardest you worked forever. Really, we aim for around 2, 3, or 4 to 6. And every day may be different. Depends even on the cycle of chemotherapy. Some days the hardest ever will be walking to the washroom. And that's okay for that day. Another day, just try and do a little bit more. So really modify exercise to keep you safe. And I said that a few times. But have something to measure how hard you're working. Calculating heart rate is not the most accurate thing for people where it fluctuates with chemotherapy and with some of your drugs as well. But this is where the rate of perceived exertion is how hard you're working compared to whatever you think is the hardest you've ever done. We spoke about keep the team informed. If there's new pain, if you're not sure, ask. And really, no question is ever stupid, because if you have that question, it's already smart, because you're asking questions. If you don't ask, that's when people can get into trouble. Where should people exercise? Everybody's different. Some people like the gym, and that's fine. Some people hate the gym, and that's fine. Everybody's different. It could be in the living room, it could be in the basement, it could be outside. Whatever works for you, then as long as it's working and you can make it part of your life. See, I told you that was enough time. That was it.
We have some time for questions, please. Yes. Just hang on a second, please. We need to use the mic.
Then I don't need to try and memorize the questions.
Hydrotherapy.
Yeah.
Does the Hamilton Uravinsky Cancer Center, has it got a pool?
That's right. We used to have a pool many years ago, but there are pools in the community. The challenge with pools depends on the immune level. Public pools are great to get infections, but if the immune is fine, for example, we have access, the YMCA has a pool with a elevator into the water, so people don't need to do the stairs if they can't. And many community pools have those things now. So the cancer centers don't have that, many of them, but many people don't want to come to the cancer center for another thing anyway, so it works.
Thank you. Great talk. I've been reading a lot about green exercise, where they show if you go for a walk in the city and you go for a walk in the park, the walk in the park actually confers more benefit things like, I think some of the things were, some of the trees give off this, some kind of killer cell that reduces pain and reduces inflammation. Do you have much of a
Yeah,
comment on
well, last time I looked, actually, it was a few years ago, so maybe things changed. But really, as long as you live south of Barrie, I think, we all breathe the same air. So it really didn't matter. Really, the pollution doesn't know not to get into the park. We wish it knew that. In terms of what trees emit, I can't say I've really seen any evidence for that. You know, but if that what makes you go out for a walk, hey, it works.
Oh, hello. Can you tell me the difference between physio and osteopathy? Like, I know it's got to do with bones, but I'd like to know that because I'm trying to consider which way to go.
Yeah. Well, physiotherapists are people who go to, most of the programs are university-based. Actually, all the programs in Canada are university-based. And we learn disease from, I guess, the scientific medical model to some degree. And that's what we focus. It's exercise, education, managing various diseases. Osteopathy is not yet really university-based. They have their own colleges and they do great things, but they use, I think, more natural resources. I'm not going to go into evidence, especially because this is recorded, but there's different opinions on the scientific merit of the two different professions. Often people have benefits from both. When you go see any professional, you need to say, okay, what they're telling me makes sense. So for example, in the past somebody asked me about ground coffee enemas. Well, sorry, but that doesn't make sense to me as a treatment for cancer myself. So it's really, you need to think what's being recommended to you and if that makes any sense at all. I'm not saying they recommend that, but it was a question I received once.
Yes, just a question about lifting weights and bone density growth or something. Obviously, my bones will get eaten away here, so I'm trying to figure out at what rate can you build bone back by lifting weights? Is there any study anywhere for that?
The bones can get stronger together with calcium and the vitamin D as long as you're allowed to take them. Of course, if somebody has the hypercalcemia, they shouldn't take probably extra calcium. So it really depends if the disease is controlled or not. So that's why it's really not a straightforward answer. Generally speaking, weight-bearing exercise can help the bones get stronger if you're allowed to do it. So for example, if somebody has a lytic lesion in their femur or thigh bone, and it may break with weight-bearing exercise, then they can't do weight-bearing exercise. So yes, exercise can help with bone health. It really, first line will be controlling the disease. And then if you're allowed to take any medications or supplements to get the bone stronger, and then you can add exercise together. So it's really need to work together with all the other components as well. Unfortunately, it's not a straightforward answer.
A question you. THC, CBD, can they help tolerate maybe different levels of exercise, recommended, not recommended?
Everybody's different. I think the growing, or with those things becoming legal now, there'll be more research that will answer that, because until now you couldn't do the proper research on it because it was considered illegal substance. But it's part of the toolkit for pain control. So as long as the pain is not hiding a bone involvement, so then it should be fine. But it's still early, I think, in the days to say that it's helpful or not helpful. I think it's just another tool that some people get great benefit from acupuncture and some people don't. It will just be one more thing to try in the toolkit to get people comfortable.
Is massage therapy good or could be potentially harmful for a patient with a lot of bone lesions?
Yeah, the key for massage therapy is that they don't do deep massage over areas that are involved or areas that you don't know are involved and you're worried about. So if somebody does the leaning elbow thing around the spine and somebody has lytic lesions in the spine, then it's wrong. If they do a more softer massage after the muscles, it's fine. And this is where you need somebody that will listen to you to what you tell them or hopefully have some experience. Good questions. Behind you. He's getting his exercise.
Yes.
Exactly. What about the old Charles Atlas isometrics?
Well, it also depends. There is no straightforward answer. Generally speaking, isometrics may be safe exercise. So by isometric, it means there's no movement while you're working on the muscle. So for example, now I'm pressing on my head, there's no movement, I'm doing isometric exercise. This is great as long as I have no lesions in my neck, right? So, or in my arm. So it's really, again, nothing's straightforward. This is where you need to know if you want to exercise, you need to know what you have in order to make it safe. So isometrics may be the right thing. So let's just try a quick exercise. So if everybody can just stand for a second. It is the end of the day, so just stand and just kind of stretch a bit. And just kind of, not hard, because if you have any lesions, we don't want hard. And stretch. That's an exercise, right? And thank you for the standing ovation at the end of the day. But just, you can sit down. But an exercise I really teach people is just sit to stand. If you can do it safely, you go to, the only time where you don't do this exercise is when you're in a rush to the washroom. But otherwise, you're going to the TV room, just sit, stand, then go. When you get to wherever you're going, sit, stand, sit, down, sit. As long as it's not the rush to the washroom, then you're getting safe squats exercise, and that gets you stronger.
Okay, we have time for a couple more questions. Please, if we could have the mic.
I exercised without permission all through my transplant and my recovery. I exercise to this day. I do yoga. I work with a trainer. And my husband and I are quite active. But I want to thank you because I've never had an assessment. And probably now we'll go home and get one. Mm-hmm. So I do have some bone lesions and L1 problem. So thank you for this. It's been very helpful.
Yeah, and I've had yoga crazies in the past, and going down on the floor is probably not the best place, so we got a mat for them on the bed, and we worked through no extreme flexion or extreme positions, but usually with the proper assessment and knowing what you have, you can find something that can work.
But I do want to say that it's been so psychologically beneficial to stay active. I think it got me through a lot, and my husband. So
yeah, I'll pay you later. Thank you.
Okay.
Do you have any exercises for restless legs?
It's just being active what you can. There's many different reasons for restless legs. And I have a son who has very restless legs. And nothing works on him beyond whacking him on the head, which is a good activity for the father. Just erase that one. But it's really being active. Sometimes it's nutrition related. So sometimes reviewing it with a nutritionist, seeing if something is missing there. But I don't have a magical cure for that, sorry.
Okay, one more final question, please.
Do you have any criteria or restrictions for older, healthy caregivers that want to do high-intensity workout?
Well, Actually, I don't work with healthy people, so I don't know. But generally speaking, it would be any assessment. There's something called the PARQ, P-A-R-Q, online, which somebody can look at it and evaluate themselves, see if they need medical clearance or not. This is true for everybody but those who we're talking about. So this is the healthy people who want to exercise. And really it focuses mostly on cardiac health, so people don't get a heart attack while exercising. But that's really looking at other comorbidities or talking to a family doctor or a kinesiologist in a community gym. They should know about that tool. But really, cancer is a family disease, so everybody should really exercise.
Okay, well, as Oren explained, and I've observed this in my own life and observation of others in the myeloma community, exercise appropriate for each one of us is hugely beneficial for our well-being, not just our physical well-being, but as was mentioned, our psychological well-being. So, Oren, thank you for an excellent and very comprehensive presentation.